All right, so we're almost 10 hours post-op. How you feeling?
Well, I don't have a headache for the first time in a long time. Even before I did everything for my headaches, from all the migraine methods to going to a pain management doctor, taking pain pills, but nothing seemed to help for my headaches. I haven't had a headache since the explant. And the other thing is that 2.5 months ago, I purposely stopped taking all meds, including pain medications. I ruled out everything possible with all the doctors, and then I ruled out everything possible with any side effects of medication just to make sure that it wasn't anything else that was causing my problems. The other thing is my stomach feels a lot better. Blurred vision, I don't really have blurred vision anymore. My vision is a lot clearer now. I have perfect vision, so before the implants, and I ended up with blurred vision pretty much every day after the implants. The other thing is I've been having the energy all day today, even though I've been on the medications from the doctor and had surgery. Haven't really been able to sleep. I've had more energy today than I've had in probably over 2 years now. So there's that, and then the swelling seems to be going away from different areas of my body. I used to swell my feet. My feet haven't swollen today. Um, just a couple other things like sweat under my breasts. I haven't had that problem today. Um, I'm just starting to honestly feel like my normal self, and it's not an exaggeration. I'm not trying to make up stuff. This is something that I'm trying to be as clear about as possible so that I give accurate results to any other people that might need help with this.
Yeah, so I had the opportunity to speak to the doctor right after the surgery, and the doctor said that he chose not to put in any drains for the simple fact that he wants the body to reabsorb the fluids. So what he told me was he went in and he put 20 cc after he took the implant out to make sure to clean out everything, and that's with the capsule. And what he did was he also cleaned out a lot of scar tissue. She complained about her left side. I immediately after the first implant, after the first surgery with the implants, and the doctor said that he found a lot of scar tissue on the left side. So he cleaned all the way to her muscle, and he stitched on the inside out. And the way he described it, it almost makes it sound like a lift. But the way that he did it, he wanted to make sure that it was in a natural form. So he was very happy with that. Still waiting to find out exactly if the implant leaked, but I can assure you the woman that went in the surgery and the woman that came out of the surgery, two different women. I immediately asked her in the back room, what do you notice differently? And what she just told you is what she said that she noticed immediately after the surgery. I mean, coming right out of being sedated. So we're definitely seeing signs of improvement. Her face is looking different. She's glowing. I'm very happy for her. I mean, it's been a long journey, and this has been, almost 3 years that we've been trying to figure this out. So, finish line, we've crossed it. So now it's just trying to continue on with the journey, making sure that we provide enough information. More so, she provides enough information for all the other women that are going through it. I'm just trying to put in my input for the significant others that are out there that are also going through it with their significant others. They are sick and, going to the doctor visits, the surgeries and things like that. So
And my doctor has helped with the appeal with the insurance. He's real patient oriented. Seems very knowledgeable. He actually works with cancer patients. Been doing this for 19 years. So I'm confident that the outcome, as far as the way my breasts look, is going to be great, and that he got everything out. The other thing is my implants. He was able to give them to me. They're yellow for some reason. I don't know why. I believe they went in clear, and they smell like gasoline, which is pretty gross. The other thing is that whenever he cleaned out everything, he cleaned it out with water. He said just to flush it out and make sure it was completely clear, and that the I guess lift on the inside that he did. I already had a lift done whenever I got the implants done. So the outside, he felt like it was unnecessary to do that until my healing.
So definitely be checking back in. Gonna try to get some rest. I know she is ready to get rest. Also, it's been a long day. So.
Oh, and no drains, by the way. He said that he doesn't like doing that the way that he does the procedure, just because he feels like the drains basically will make the breast droop over to that area of the drain. So he doesn't feel that drains are necessary.